Thank you. Dr. Battaglia, your comments.
Good morning. I'm delighted to be here to represent the National Navigation Roundtable. So for those of you who are not familiar with roundtables, roundtables are really a mechanism that are meant to bring together leading voices around usually a cancer-related issue. It's meant to bring people from the public and private sectors, from the medical community and the civical community together to have a sort of unified voice and leverage their talents together to move a process forward. And so historically, navigation roundtables have been supported by the American Cancer Society. And as you know, the American Cancer Society has been very devoted to patient navigation as a care delivery model. And they have again come to the table to support a roundtable around patient navigation. You probably are most familiar with the colorectal cancer roundtable, the National Colorectal Cancer Roundtable, that has been really a force to be reckoned with in terms of moving us forward around the issue of colorectal cancer, you know, the 80 by 18 initiative. And so we're searching for what our tagline will be for the National Navigation Roundtable. What is our 80 by 18? Historically, the group came together a couple of years ago to think about how we might move this work forward. And in 2017, the American Cancer Society supported the Roundtable Initiative with resources. And so we convened a steering committee of like-minded folks from multiple sectors back in January, I think it was January at the beginning of this year, to think about how this roundtable might function. And we developed a structure with a steering committee and identified a group of organizations of about 40 organizations that represent sort of all the different sectors. And so I am not alone here today. Many of the roundtable members are present. I'm going to ask if you're here to please stand and be recognized. You've heard from many of them over the course of the past 2 days. Yes, Elizabeth, yeah. See, we're well represented here. We do have a director who's also here, Monica Dean, if you can stand up. So Monica is the force that keeps us organized. And she actually has some handouts for folks if they're interested in learning about sort of what we are and who we are. And so I also have some copies here that I'm happy to share. So I'm going to share with you our vision and our mission and then tell you a little bit about our inaugural meeting, which just happened last week here in DC. We're really, really excited that the timing of this meeting today by the National Academies is really helping us solidify our direction, and we certainly will take everything that we heard and learned from the conversations over the past day and a half to help us solidify what our work is moving forward. And what we hope to hear from all of you today and moving forward is how your collective voices can help us move forward. So our vision is that we are a collaboration of organizations and individuals dedicated to achieving health equity and access to quality care across the cancer continuum through effective patient navigation. We aim to advance navigation efforts that will eliminate barriers to quality cancer care, reduce disparities in health outcomes, and foster ongoing health equity. We focus our work in 3 areas. And they really were identified through an assessment of sort of where the gaps are. We've heard a lot about them over the course of the day and a half, so I think we're on the right track. One is, the first task group is evidence-based promising practices, really establishing an evidence-based, outcome-driven patient navigation model. The second is training and certification, ensuring that there's an activated, trained workforce to implement that model. And then the third is policy, establishing policies to support paying for implementation of that model. I think we heard a lot in the past day and a half about all of those areas. So when we came together in our meeting last week, these task groups got together to identify sort of steps to move forward. And I'm not going to take the time to tell you exactly what direction we're going in, but essentially what I think all of the 3 task groups have sort of identified is that we really need to be making the business case model for how do we take patient navigation and make it a sustainable model. And we need the right metrics, the right competencies and trainings, and we need the right sort of policies in place for us to be able to do that. And so we don't have a website yet, but we do have an email address, and so we're going to be able to share that with you to get your feedback if we don't get the opportunity to have the conversations today. So I'll stop there.